Welcome. My name is Jasmine Kamboj, and I'm a medical oncologist and hematologist in the state of Minnesota and your host for the day. Empowering Oncologists is a podcast brought to you by OncoDaily, where we will focus on day-to-day concerns of an oncologist's being and workflow, with a vision to find sustainable solutions. We hope to share our stories of wins, losses, resilience, and inspire and empower our community because we fly higher and longer when we fly together. Before we dive in, a disclaimer. The views shared on the podcast are in individuals and in no way are contributions from any institution, organization, or guidelines. For our session today, we have Dr. Vincent Rajkumar, who is an endowed professor of medicine at Mayo Clinic, Minnesota. He is a consultant in the Division of Hematology, where he chairs the Myeloma Amyloidosis Dysproteinemia Group. He received his medical degree from Madras University Christian Medical College and completed his residency in internal medicine at the University of North Dakota School of Medicine. He finished his fellowship in hematology and oncology at Mayo Clinic. He is a global leader in the myeloma space, and besides his work, he loves to listen to music. Dr. Rajkumar, welcome and thank you for being here.
Thank you so much for having me. Pleasure.
Yeah, thank you. Tell us about your journey from India to the US. How did all of this work out for you?
Thank you. Well, I moved to the US in 1992. And that was mainly driven by my desire to be a hematologist. I had already decided in med school to be a hematologist. And I had a really great mentor at the Christian Medical College, Vellore, Dr. Maman Chandy, who is one of the most renowned hematologists in India. And I wanted to be like him and be a hematologist. And there were no subspecialty training programs at the time there. And so I decided to move to the US. I came here to do residency and then pursued my dream of being a hematologist.
Wonderful. So may I ask, how were you so clear in medical school to go after hematology? I mean, when I was a medical student, I had no idea what I wanted to do in medicine.
Yeah, I mean, actually, it's interesting that you asked that. I mean, the Lancet wrote about this in a whole feature called Madras to Minnesota on me years ago, almost like 10, 15 years ago. It's really because I saw patients with blood cancers who had a very high mortality rate with hardly any treatments. Like they were saying 10% survival for acute leukemia, no cures for diseases like multiple myeloma. So I was very much like, hey, this is a field that we can make a huge difference in. And so that's on the one side. And then on the other side is you're always drawn to somebody who's very inspiring. And Dr. Maman Chandy was a person like that. He was very inspiring, very knowledgeable in the field, had a vision of what he wanted to accomplish. And so everyone wanted to be like him, including me. And so that drew me into hematology as much as the disease itself. So a good mentor, a good inspiring leader in the field can really shape where you go to. And that continued for me even after coming to Mayo.
What would you say were like some of the inspiring insights that you learned from your mentor that really encouraged you to go after a field like hematology or multiple myeloma? Was there something specifically inspiring?
Yes. Two things. One is the care that we can provide a patient in India, at least with a very severe hematologic malignancy. I was told varies quite a bit depending on the ability to pay. So that for certain patients, we can do everything. For certain patients, we can only do palliative treatment. So that was like a big thing for me. Like, hey, cost of treatment affects curability and lifespan of people. And that because these were very intense treatments. And the second thing was with limited resources in a country like India, if you had only a certain amount of dollars for, say, charity care, that we had to really decide which diseases that you will actually treat with those monies. Like, so for example, curable diseases like Hodgkin's disease, ALL, would take priority over incurable diseases. And so those disparities really made me think very hard about this field. Most of the other treatments that we were using at the time for other diseases were either surgical treatments or antibiotics, whereas here it was really very fascinating, the types of drugs. Even in the old days with chemotherapy drugs, very little was known about them for a medical student. It was all a mystery, and that mystery attracted me.
I so agree with this, that whoever is our faculty and mentors, they really shape our future in a lot of subtle ways. And it's probably not sometimes clear in the moment, but 10 years down the road is what we realize that, oh, that's what I'm doing this because of this individual. So
Exactly.
they're key in in shaping our futures. Dr. Rajkumar, tell us about your journey at Mayo Clinic. You were a fellow here and then you never left. You are an endowed professor now. So how did you step up your roles and transition your roles?
So, again, academic success is not easy nowadays, or even in those days. It's a lot of it is luck is involved, and I think I view myself as just being very lucky because I came to do fellowship at Mayo, and without knowing what I would do even after that, and without having any specific disease in mind. I was not interested in multiple myeloma specifically or anything like that. But again, it's very similar to what happened to me at the Christian Medical College in Vellore. I come here and I meet Dr. Kyle, Dr. Gertz, Dr. Gripe, really superstars in the field of multiple myeloma and tremendous mentors who were willing to work with fellows, work on research projects and writing papers and things like that with us, that I just gravitated to that field. They were willing to spend the time with me and give me the advice and mentorship I needed. So it was more that I went into a field that they worked on rather than myeloma particularly being something that's, anything unique compared to, say, lymphoma or leukemia. I also got involved the same way in oncology because we did Heme and Onc. I was also doing a lot of work on brain tumors with Dr. Buckner, who was the head of the CNS group then. And so really, on the one hand, I was doing a lot of brain tumor research works and papers, and then the other hand, the multiple myeloma, purely because those were the mentors that I worked with.
Right.
And then I got offered the position to stay at Mayo by both divisions, both Heme and Onc, and then that was a really tough choice. And there too, I would say, luck is there, right? Because I picked multiple myeloma, not knowing that we would actually make dramatic progress. Because when I accepted the job in 1999, it was only melphalan-prednisone and some stem cell transplant. And then right after that, you get into thalidomide and everything else, and suddenly you've got a completely new field.
Right. And you were instrumental in bringing thalidomide back into the myeloma space, or back into the...
I wouldn't say I was instrumental. I think Dr. Barlogi and his team at Arkansas really were the pioneers who found that the drug worked. Patients inspired it. Even Dr. Bergsagal was one that started the idea. I just happened to be in the right place at the right time. They had found that the drug worked, and Mayo is a reputable institution where we were able to validate the study and say, yes, it did. It does work.
Right.
And being the first to confirm the Arkansas group findings and being from Mayo meant that I got a lot of openings to do trials with that drug.
Right. So is there anything in particular that tipped you more in favor of myeloma versus CNS tumors?
No, at the time, between the two, my research here was in hematology.
Got it.
I was doing a lot of work with angiogenesis in the fourth year, and the story of thalidomide was just breaking, and I felt like this is my research lab interest, and it aligns with that. So I picked hematology.
Dr. Rajkumar, you're highlighting such an important point, because sometimes when we are going forward in our life, we don't have clarity and we don't have all the answers in our pocket. And I'm actually doing a little discussion about this, that sometimes it's okay to just say yes when we are not clear about all of the answers, right? And those answers will come along as we move along. It's sometimes we kind of, analysis paralysis, happens and we're not able to move forward. So I think your point is extremely important to understand for youngsters and early career trainees to move forward. Wonderful. Anything in particular you do to inspire our fellows to go in hematology? Because I think the natural ebb and flow of hemonc fellowships is such that a lot of us try to like somehow lean towards solid tumors or gravitate towards solid tumors. Anything you would like to comment there? Like, how do you attract fellows to hematology?
No, oncology itself as a discipline, both heme and onc are really fascinating because we deal with diseases and with drugs that are so specialized that very few people feel comfortable outside of the oncology field in handling patients who are on those drugs. I mean, everything we get a consult on just because someone's on one drug, and that's it, because it's completely and each of these drugs has such diverse array of side effect profiles that we are a very much needed specialty both for patient care and for managing all these advances that are happening. Plus, we are a very scientific bench to bedside type of field where a lot of advances are directly researched bedside and fast advances coming. So I think overall the field is either heme or onc is great.
Right.
Heme is really, I think, very attractive for even though it's a more rare field, because of the striking advances we have made with multiple myeloma, with CLL, with lymphoma treatments, Hodgkin's disease. You do get a lot of satisfaction that patients are doing well and so much better. Like I entered the field with a median survival of 2 to 3 years, and now we're saying 12,
Decades.
13 years and potentially, living out a normal lifespan. That
Right.
gives you a lot of joy. You also have very good biomarkers to follow in heme malignancies, without doing aggressive imaging and things like that. So it helps me find the answers faster. I don't have say that one's better than the other, but heme is equally good and equally attractive as a field, I would say.
Yeah, no, this is great because you're absolutely right. Like even when I was a medical student and we read about CML, it was a fatal disease, and now, it's such a great discussion to have with the patient who thinks that they have cancer and they do, but then you are like, no, for the most part, you're gonna have a normal life expectancy.
Exactly.
So it's great, wonderful. Dr. Rajkumar, International Myeloma Working Group. Tell us about it and what is your role with them? I know you are in a lot of leadership roles with the working group.
Yes. So the International Myeloma Working Group is kind of unique because I don't think too many other disease groups in oncology or elsewhere have something like a full-blown international group that works together from all countries. It was founded by the International Myeloma Foundation at a time when we didn't have too many major advances, but just to get people together as thalidomide, lenalidomide, bortezomib were coming in. And it was just a natural evolution where I led some of the initial papers, particularly the response criteria for multiple myeloma, which was one of the key papers using which drugs were then approved. I became a leader of the group along with Dr. Dury, and then now I lead the group along with the steering committee. We have 350 members from all countries in the world, and we have published more than 60 guidelines and research papers over the last, say, 22 years. And guidelines, our response criteria, our diagnostic criteria are universally used by regulators for approving drugs, for clinical trial development. It's something that I really, really cherish and enjoy, the camaraderie of bringing everybody together. We meet twice a year in face-to-face, in person. Once in the US and once in Europe. And we have multiple committees and meetings that go on year round. Very satisfying. I think by working together, we've been able to align our trials, align our treatments, and produce guidelines that really can help physicians who are not really specialized in myeloma take care of patients, because we provide the algorithms for them to follow, the risk stratifications. A very collegial, close-knit group.
That's awesome. Is it hard to create guidelines that are applicable universally specifically for like low middle income countries, and India being one of them.
Yes, it is very, very hard. And so we do have a separate Asia Myeloma Network as part of as a subgroup of the IMWG, as well as we also have the Latin America Myeloma Network. Um, and so there are times when we publish separate guidelines for Asia or separate guidelines for low and middle income countries. And so we are right now doing a newly diagnosed myeloma guideline. And I was just talking to the lead authors that we should have algorithms which have the full quadruplet, transplant, doublet maintenance and all of that stuff. But we should also have a separate algorithm in case the quadruplets are not available or in case the doublet maintenance not approved on what we would recommend. And so we are trying to do that all in one paper so that everywhere, people can use it.
Absolutely.
I also do UpToDate, and I've done that for more than 20 years. And that's really helped me as well because we've tried to align the Mayo guidelines, the UpToDate guidelines, the IMWG guidelines, so that we can provide a really coherent message to the world on how to manage myeloma. It's one disease, but I think the map we have followed is to align ourselves so that we are able to provide recommendations that people can actually follow.
Those are some fascinating insights because sometimes I feel like we're too spoiled in the US and we just assume that the rest of the world has those resources that we routinely utilize here. So it's really good to know that your group is very thoughtful about those limitations in other countries. Awesome. Dr. Rajkumar, you are an avid social media user. Tell us, how has social media helped you to educate and empower others in HEMONC community?
So I have been on, I wouldn't say social media because it's mainly Twitter. I don't do other forms of social media, actually. It's just very hard to keep up. But I found Twitter and now it's called X, as a platform where a lot of the other people you wanted to talk to academically were on. It was, for me, mostly a professional, like, I wouldn't say professional in the sense it's not a Mayo thing, but it's for academic
networking site,
academic networking, academic dissemination of knowledge, academic learning,
absolutely,
within and outside the myeloma field. I felt that the key players were there: the patients, the academic thought leaders, the physicians in practice. Everyone was there. And the discussions we were having were 90% academic and not much like other things. And I found it very influential also. Like you could say something that for example, like I've been involved with the thalidomide story from the beginning, and interviewed all the key players from the beginning, from Dr. Barlogi to Dr. Folkman and everyone, and written about it, but still missed the aspect that the very first insight on maybe angiogenesis therapy and the thalidomide treatment came from one of my own colleagues at Mayo, Dr. Bergsagel. And but how to disseminate that information? You could write another paper about it, but papers are read by 1,000 people or maybe 500 people, hardly. And so I just use social media, and you can see I was telling Leaf, like, hey, 200,000 people have seen that your picture, and that you started the thalidomide idea in at least a small way. I find it very useful for dissemination. So for younger fellows and things like that, if you have your own idea that this is actually perhaps the way to do things, or you have a paper that you've written that you want to tell others about, or a new idea or something, being diligent on social media and building up a following and a network will help you disseminate it one other way besides writing books and book chapters and papers. I view it as equally necessary nowadays.
I so agree. It's kind of like how we are getting our feet wet in the AI space too, right? Like we have to learn it. There's no way around by not knowing it or by shunning it down. So especially the younger generation, I mean, last year, one of the projects that ASCO did for their leadership development program was exactly this. Like, how do we make the younger generation more tuned into things like ASCO? And one of the suggestions that came out was to create, the ASCO.org could be a little more interactive and engaging. Like kids are doing these YouTube shorts, which are a few seconds long. They do not have the patience to read a book chapter or like a full article that might require a
Correct.
couple of minutes or an hour even.
Correct.
You are so spot on that we have to get ourselves involved in the social media space or AI space. And I'm an advocate at heart. Like I do a lot of advocacy work and policy work. And it's almost like if we are not disseminating this information, there are others who probably are spreading, misinformation or wrong information. And so I think it's a responsibility that we do that. And you do it phenomenally well, Dr. Rajkumar.
No,
So
thank
thank
you.
you for that.
Thank you.
Thank you.
Thank you so much, Dr. Kamboj.
One advice you would give to yourself of 10 years ago.
10 years ago, I was too impatient. Maybe that helped me. I was probably too, I might have hurt people's feelings by, all the stuff that I wanted to do very, very quickly and, and do this and that. And many regrets I have are, oh my God, I wasn't kind to that person or kind to this person. And I wish I had been more patient and listened to their perspective. I didn't take well to people questioning trial designs that I proposed and things like that. And I think those are all like things that I regret, because you could accomplish the same thing and still not be like, somebody whose actions hurt other people's feelings or things like that. I haven't hurt anyone's careers, but certainly major arguments, major things. I wish I hadn't done that. Also, more focused. I did get distracted quite a bit by things outside of my field. COVID, for instance. I partly because I was scared of the pandemic itself, but it did take a lot of time away from multiple myeloma research. And now looking back, I'm like, okay, maybe there were so many voices. What exactly did you do? And why were you so active?
Very good.
Focus, not losing the focus, being kind and patient.
It takes a lot of courage and wisdom and maturity to say what you are saying on the podcast. So I appreciate that.
No, thank you.
All right, Dr. Rajkumar, a little bit of a fun part of the podcast. So this is rapid fire. Your favorite book?
Favorite book? When you asked that, I was thinking like, man, I don't read that much nowadays books as much as news media and on the internet. But one book that's influenced me, it all goes back to people who inspire you. I've really been inspired by Michael Jordan. As a person who's that singular mind, this is it. I need to be the best. But more than that, coming to work every day wanting to be the best, and coming to work every single day thinking this is your first paper. I still feel like, the fact that he would come and play every game as if it was his first game. That inspired me. I still treat every paper like it's my first paper. I'm still writing every single. If it's my name on the paper as the first author, I have written the paper. There's no, I do everything, including the comma and the thing. But that inspiration came for that. And the book is like Playing for Keeps by Halberstam. So that's where I learned about the focus of this person on how to play the game of basketball, and the desire to be the best, and the desire to come to work every single day, work harder than everyone, kind of thing. And we had to, I came from India. The fact that you get to stay in the US itself means that you're going to have to work 10 times harder.
Absolutely.
To get where you need to be. And so that book was a very big inspiration for me.
Yeah, wonderful. Do you play basketball?
No, my kids do. I after they started playing, that I would just play in the front yard with them, but not.
Got it. Okay. Your favorite non-hematologic study?
Like in terms of like
a cancer trial or something in the oncology space.
Oh man, that I really haven't thought about that one. I think probably the one that I keep on thinking about a lot and it has really influenced me. I don't know the name of this trial, but there was a trial done years ago in cardiology. Maybe it's ISIS or something like that. Anyway, this trial looked at antiarrhythmic agents like flecainide, encainide, and something else in the suppression of ventricular premature beats, and as a way to prevent ventricular fibrillation and sudden cardiac death. And these agents were highly active in doing that, but actually the mortality was more with the treatment.
Oh, no.
And so it really, I read about it in med school. And if you ask me now, that has influenced me throughout. Like, I don't assume just because we get a response, we actually are making people live longer lives or better quality of life. And I've kept that in mind throughout, that overall survival is a composite endpoint. It depends not only on the efficacy of your treatment, but also on the safety.
Absolutely.
So that was one of those trials that people in cardiology know well about, which shows that, yeah, you can suppress the VPCs, but then still they have higher mortality.
I think that is applicable in our field too, right? Like oftentimes we're like, okay, you're in remission right now, but your performance status is so poor or your cardiopulmonary status is so poor that you're going to probably die anyhow, right? So we forget that there are other diseases beyond cancer that also can be fatal.
Yeah.
That's very important. Your favorite restaurant in Rochester?
We have a very limited choice. I would say the one that I like to go most is Chester's. It's close to Mayo.
Okay.
They have my barbecued shrimp, which I like.
They know you well there.
They know me well.
Are there any Indian restaurants in Rochester?
There's one that we used to go to and it closed.
Okay.
The best Indian food in Rochester is in our homes.
Aw, that's sweet.
We have a bunch of friends,
Yeah.
Indian friends, and they make really good food.
Aw, that's sweet. That's sweet. Yeah. Your favorite musician?
My favorite musician. I have a ton of favorite musicians. But my idol and somebody whom I keep on the same pedestal as MJ is a singer called S.P. Balasubramaniam, who is a singer who passed away during COVID, off COVID. He is the one who has sung the most songs of any human for recordings, 40,000 plus. He's called by the short name SPB, if anyone wants to Google him. He has a voice that is like the perfection, like absolutely, and also a skill level that is perfection. But just like Michael Jordan, he would also sing every song like it was his first song.
Aww.
He would put his whole heart and soul into it. And
that's awesome.
Very inspiring, both for the fact that the skill and the voice quality was so spectacular, musicianship was just amazing, but also that whole ethos of hard work and just giving it your everything.
Is he the singer who has sung many songs for Salman Khan?
Yes.
He is. Okay. All right. Yeah, no, he has a wonderful voice. All right. Our fun fact question about you. What kind of music do you like?
I like a lot of different kinds of music. I listen to a lot of Indian music, Tamil, Hindi, A.R. Rahman, Ilayaraja. Those are favorite musicians for me. I also listen to a lot of heavy metal stuff in my car, particularly Megadeth or say Dream Theater. I do like classical music as well, so I play that often as well.
What instrument do you play?
I can play the guitar a little bit. I learned the piano with my kids a little bit. All just dabbling, not
that's
focused.
Sweet. Do you guys have a little band of yourself?
We do. The Myeloma Group always jams every single year at the Myeloma Working Group meeting in Europe. We always make up songs, make up new lyrics, and celebrate our award winners. Every year we do that.
That's wonderful. I'm going to share this with Monty Powell, who is like a friend, and he has a little band with his kids in his garage.
Yes.
And so he's always trying to persuade others to come join.
No, I've seen videos of that he has posted.
All right. Our last question for you, Dr. Rajkumar. If you were to relive your life, would you become a hemoncologist?
Oh, yeah, absolutely. I mean, I do think life as like a singer or a musician would be like a really good alternative. But overall, like the work and the impact you can have on people's lives, and particularly in hematology oncology, where it's not just the drugs or the environment we are in or the thing. It's really like, counseling and things like that, and the ability to both impact patient care one-to-one as well as on a larger scale through your research. Yeah, I think this is what I would do. I'm very, very fortunate, very fortunate. So, like, if I could do this again, that'll be awesome.
Wonderful. Wonderful. Thank you, Dr. Rajkumar.
Thank you.
3 key takeaways for the hematology oncology community. I had so many key takeaways through this, so I almost lost track and I couldn't even take full notes. But I guess the number one point is we need to pay attention to the role mentors play in our lives. In a lot of clear and obvious ways, and in a lot of subtle ways, they really shape our careers. And we obviously need to recognize that, as their mentees. We need to appreciate that as mentees. And to all the awesome mentors out there, we won't be where we are without your help and support. So thank you for all that you do. Number two, in addition to all the hard work and stuff that we do on a daily basis, I think luck does play some role. As Dr. Rajkumar said, it's important to be at the right place at the right time. Now, you do have capacity to enhance your lucky points by trying to be at as many places as you can in the right, scenarios. And so that does increase your luck, but luck does play a role. But don't forget to do your part to enhance your fortunate points. And last but not the least, it's really important to take every day as your first day at work. I think Dr. Rajkumar said it so nicely that if you pursue every clinical trial as if it is your first trial, or write every paper as if it is your first paper, or every day at the job is your first day at job, I think that does reinvigorate us, because sometimes we all are, we do get exhausted and we are human beings. But I think to remind ourselves how fortunate we are to be doing what we're doing, I think it's really important to keep that in mind. Well, thank you so much. Thanks to our viewers and listeners. This is Jasmine Kamboj and Dr. Vincent Rajkumar signing off on behalf of OncoDaily from our conversation today on Empowering Oncologists. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.